Hi, my name is ZOILA Reina. I am founder of Public Health Hired, an agency that is committed to helping public health professionals advance in their career, whether you are a student, a recent graduate, or a working professional. I am so excited to share with you some really important considerations for your job hunt as you are out there looking for work in our field, whether it's directly in public health or in relevant fields such as public administration, public policy, or healthcare administration, and anything in between. I recognize that you are probably really struggling with finding jobs. I also want to warn you that yes, it does take 4 to 8 months on average to get hired. How do I know this? Not only from my own experience being a public health professional for over 16 years, but helping now to date 136 individuals get job offers in reputable companies with zero networking, as well as paid internships. So I am speaking from experience on my platform on Instagram, as well as on my website, on LinkedIn, on YouTube, and on TikTok. I do share the best practices and proven techniques on how to get a job in public health. So here in the next few minutes, I wanted to share with you some considerations to take, the symptoms that you're feeling as far as being stuck in the job hunt, how to diagnose it for yourself, and how to move forward and actually break through into a job that you're looking for. So, number one thing is if you are feeling stuck, the symptoms of that are related to feeling like you're in a search loop. So you're probably feeling like you keep finding the same types of jobs. There's not much diversity. You keep seeing repeated job postings too much. You feel like you're seeing the same kind of industry. Maybe you're only seeing healthcare and hospital. Maybe you're only seeing nonprofits or only seeing government type jobs. So that is one symptom that you feel unstuck. Another one is that you are not able to use a diversity of search terms. So you're probably sticking to the same kind of search terms and you're relying too heavily on title searching as well. So if you're not able to keep the ball rolling and find different search terms relevant to your experience, to your skill set, to your interest areas, then that is another symptom that you are stuck and that you need to really consider other strategies to break through and push forward through that sort of veil and frustration. Another symptom that you're stuck is that you're confused when you're reading jobs. So if you are reading job boards and you feel like you're reading another language, you feel like you're reading French or Japanese, then that's another symptom that you're stuck, is that you haven't taken the time to actually study the jobs and study the job announcements in a way to really grasp it, to really understand it. If certain terms like technical assistance or capacity building or project management are foreign to you, then that is another symptom that you need to spend more time studying the job boards and actually spending more time on the searching and reading through the jobs and actually using your critical thinking on what do these terms mean and are they relevant to my experience? And oftentimes they are, because in public health, we do so much in this industry and we take for granted our skill set. So I'm going to talk a little bit more about that in a bit. But those are some considerations that you are stuck, and how you diagnose it for yourself is just recognize that you may be focusing too much on a certain focus area. So maybe you're super passionate about maternal health or nutrition or mental health or chronic disease management or health equity. And if you feel like you're holding on to just that focus area solely and you're not opening up a little bit more to other relevant areas that could be within that scope, then that is a way to diagnose your mistake. So that is one great way to just be aware if you are too much in a search loop, too stuck in your ways, and to consider how to open up to other focus areas. That is one reason to download my key terms guide. It's completely free on my website so that you can open up to more focus areas similar to what you're already interested in. The other way to diagnose that you are in this search loop and that you need to move on and kind of keep the searching improved is that you take for granted your unique skill set that you've been practicing, that you already carry, that you've already demonstrated in your experience. What I mean by that is the skill sets that you have, such as implementation of programs, evaluation, stakeholder management, relationship management, patient engagement, community engagement, helping with quality control, implementing standard operating procedures, helping with compliance, helping with regulations. These are all skill sets that we take for granted usually if we're new to the public health workforce. So that is one of the reasons I highly, highly recommend you download the key terms guide, as well as consider other ways to search around those skill sets in particular. So be mindful of that. If you're searching too heavily for jobs in relation to focus areas and not aware of your skill set and the unique skill set that you have to offer, then start digging deep on that. Ask yourself if you have skill sets around technical assistance, capacity building, coalition building, implementing best practices, and so many other ways that you are probably taking for granted your skills you already have demonstrated, but you're not verbalizing and you're not writing on your resume. And then another way to diagnose that you need to get unstuck and how to kind of move forward is that you assume your previous jobs in non-traditional public health roles are not of value. So I run into this a lot from my followers on Instagram and my mentees who are in my hired mentorship program, when they just assume that they have to leave off jobs like when they worked in retail, or when they were a bartender, or when they were a server, or worked in fast food, or anything that you think is not quote unquote public health. I'm here to tell you that all of your experience, whether it's traditional public health or non-traditional public health, is a value on your resume. The strategy and the consideration that you have to take in is simply that you need to reframe that experience in more polished, upgraded public health terminology. So what I mean by that is, if you were a server, for example, you need to use terminology like, supporting, implementing, tracking of inventory and helping with quality control and sanitation and food standards, implementing compliance of company standard operating procedures. So you need to use that kind of terminology instead of what you're already using. So that is one really big red flag if you're leaving off a lot of non-traditional public health jobs, when really you can still have them on your resume. You just have to reframe them and upgrade the terminology. Again, another reason why you should download the free key terms guide provided on my website. So just to kind of summarize, yes, there are some symptoms and some ways to diagnose these symptoms in relation to you being stuck and not finding enough jobs, and considerations for your job search. So hopefully these symptoms and the diagnosis of them have helped you. But the solution, there's a few solutions I have for you. Number one, I've already been saying that, is download the free key terms guide. I just recently updated it in partnership with a key terms committee. They are subject matter experts in public health, and they brought their own perspective. We have 69 key terms across 18 pages with definitions, example of uses, how to use them in a sentence, example of transferable skills, and citations. So you have lots to study. If you have not downloaded that key term guide, it has been downloaded over 1,500 times, and it is the #1 best way to get you unstuck and really challenge yourself on how to improve your job searching and upgrade your resume immediately. And then the other solution I have for you is continue to make friends, quote unquote friends, on LinkedIn. So you don't need to know everyone that you connect with on LinkedIn. You just need to friend them and say a quick hello. Hey, I noticed we have similar background, would love to connect. That's it. The reason that I recommend this and that it has helped my mentees, my followers, and anyone who takes this advice is simply because the algorithm of LinkedIn starts to assume you know these individuals and will start throwing jobs on your job feed, recommending better jobs for you in relation to the companies that your network is associated with. So if you're eyeing a company, if you wish you worked at a certain company, or if you are out there on the job boards, but you just don't know how to improve your job searching, that is one easy strategy, is just go make friends with strangers, different, maybe even the states that you wish you could work in, the companies you wish you could work in, and find those people at that company with a similar background in public health or healthcare administration, public policy, public administration, and actually friend them. Most people will just connect. They don't really ask for much. You're welcome to follow up and see if they want to connect with you and share their background or how they got their job or what their job is all about. That's fine. But some people don't have the time, and it's enough for LinkedIn to assume that you know them and to improve your algorithm in association to that. So that is one great way of getting out of your search loop and feeling unstuck. And lastly, one of the other best tips I have to provide, which is covered in the Hired Masterclass. I highly recommend checking that out if you haven't already. But be aware of the 7 main industries that hire public health professionals. So you probably know the more common ones, like nonprofit organizations or large non-governmental organizations. Foundations is another one that are known for hiring colleagues such as ourselves. Government organizations, whether it's at the federal level, state level, or local level. So think of counties and cities also hire public health professionals. And then the other spaces that you may not be so aware of is the universities. Not only do universities look for, research related roles, but they also do external facing roles. So they do sometimes get contracts and are subcontracted to actually provide community engagement and community service within their communities. So universities are very competitive to get those kind of subcontracts, not only for on-campus, but off-campus type work. And then you have private organizations, consultancy groups. These are a little harder to find, but you can really improve your searching if you go make friends with other LinkedIn professionals who work within those companies. You can go on my own LinkedIn. You're welcome to friend me, or just search through my network. I've got lots of people on there who work at private companies, like Guidehouse is a good example. Leidos, Leidos is another one, who really are known for getting subcontracts for public health. And then lastly, the 7th major industry is member-based organizations, member-based associations. Think of the coalitions, think of the associations. Yes, you have the traditional American Lung Association, American Cancer Society, American Diabetes Association, but I want you to think broader than that. There's also the Association of State and Territorial Health Officials, ASTHO. There's also NACHO, the National Association of City and County Health Officials. Those are 2 other major big players of associations. And then there's more, because there's a lot of what public health individuals do. We are the intersection, we are the interlock between healthcare and medical professionals and the community, as well as working with government and subcontracting for government. So we actually, as an association, there's a lot out there that support specific medical professionals, whether it's respiratory care professionals, whether it's primary care providers. There's also organizations like the California Primary Care Association. These organizations are looking for public health or professionals like you to help them with providing trainings, webinars, conferences, events, engagements, just around everything that they have to do to really increase the readiness of the workforce. So keep that in mind. There are 7 main industries that really are hiring public health professionals such as yourself, such as me. And again, I will repeat them. They are nonprofits, government, foundation, universities, private and research, as well as member-based associations. So keep that in mind when you're out there job searching, that you really need to keep it moving, that if you're not seeing these main industries in your job search, in your job feed, then you probably are also stuck, and you need to kind of open yourself up to those as well. So hopefully this, quick conversation about how to consider strategies for your own job searching and breaking through and finding a job for yourself, your dream job, it's really possible. I promise you, you are simply still learning on how to improve your job searching and how to better represent yourself on paper, on your resume, on your cover letter, and how to speak the language of public health in interview prep. So if you want more information, check out my website. I have the Hired Masterclass, which includes all of the techniques that I teach around the Hired method. Some of this I already shared on this video, but you're welcome to check out the full methods on the masterclass. It's an e-learning course. It's self-paced. You get unlimited access when you download it. And then the great news is you're automatically invited to the live Hired Masterclass that happens every 6 months. So whenever you download, you are automatically invited to that next one. And then you also get a 30-minute mentor session with me. So you're welcome to download the masterclass, and then you get my calendar availability right after that in an automatic email. So would love to meet with you to help you get unstuck and provide you some further guidance on your unique situation. And then I also have the Hired Mentorship. This is a unique opportunity where if you want to retain a mentor until you get a job offer, until you secure employment, this is the best option for you. So I have availability in the mentorship about every 6 months, and you simply have to get on the wait list, and then I send everyone on that wait list when enrollment opens up. So be sure to check that out. The next opening is April 2023, and then after that will be September 2023 when I open enrollment. But that is for you if you want to work with me on a weekly basis to make sure you get hired. Again, the mentorship ends when you get a job offer. So that is how sound my methods are, and how I know for a fact I can help you break through and find your dream job. Also, don't forget to check out the free resources. I have the Instagram community where you can connect with your colleagues. You can see the success stories and connect with individuals who've gotten successfully hired. They are tagged on there. And you can also absorb all of the free videos, the free tips. And I also have links to job alerts where I post jobs about once a week on my stories, and I provide the direct link on there. So lots of ways for you to continue to move, keep the ball rolling, keep learning. This is a community for you to really help you advance in your career. I'm here for you. Let me know if you have any questions. Keep calm, job hunt on. I am cheering you on. You can do this.